Halloween is one of those holidays that's filled with scares and frights, but for some people, anxiety is an everyday occurrence. Today, we're talking with Dr. Stacy Chronister, an internal medicine specialist with OSU Medicine, about fear in general. Good morning.
Good morning.
Fear is not a bad thing.
It's not a bad thing. It keeps us alive. I mean, you've heard that phrase, the fear of the thing is worse than the thing itself. And oftentimes our brain does that, right? It makes us scared of things that could harm us, and it keeps us away from those things. So it's very natural. We have to worry, though, about when that fear is more than what is normal in regular life.
And sometimes when you are worried about something, it just becomes magnified.
Yes, and almost becomes a habit is right? A lot of what I say. Okay. You know, you kind of, it took a long time for us to learn to stop covering our sneeze with our hands and it's to use our elbows, right? Mm-hmm. I say it became a habit. Unfortunately, sometimes we get a bad habit of something happens and we turn anxious almost right away because we've developed that habit. It takes us a while to undo that.
Is there a way, though, that doctors can have conversations with patients about fear and kind of really gauge, are they really afraid of something, the anxiety, how serious of a problem it is?
Yeah, because I think sometimes you just think, well, yeah, I worry about things, but they're rational things, or I have a hard time sleeping because of this. But there are certain times that you think, okay, but that's a little more than it should be. You know, how many times a week is it disrupting your day, and is it really something that's going to happen or not?
Now there is a guide or a
absolutely.
It's called GAD.
GAD, so general anxiety disorder,
okay,
or
so
GAD.
We're going to put this up on the screen, and you kind of walk us through each of these questions.
Absolutely. So feeling nervous, anxious, on edge, unable to control or stop your worrying about different things. This is not just one thing that's a problem. You kind of worry about everything. I have trouble relaxing. Do you sit down at night to watch TV and feel a pressure on your chest that you just can't really relax? These are things, and we have a few more, I think, that are often involved, but how many times a week do you feel this way, or a month? And do you feel that you are having multiple of these issues at one time? You might have something more than just normal fear and normal anxiety. You might have more of a general anxiety disorder.
Yeah, and one of the things, it's like being easily annoyed, being irritable.
Yes.
The fear of something awful will happen.
Yes, even though nothing has proven that that will be the case, but you worry about the worst case scenario, which in some ways protects us, but in some ways prevents us from living our best lives.
Yeah, and then I know some people, they simply cannot sit still. And it's not ADHD. I mean, it's really just because they're constantly in motion.
And maybe that is the situation where once they settle down, they start to feel that anxiety on the inside. So if they keep moving, that is when it releases just a little bit, or they can keep their mind off of their own anxiety. Absolutely, that is someone that I would love to talk to and see if there's ways that we can help.
Is medication
absolutely available, as well as therapy, and maybe even both depending on the patient. What is nice is that a lot of the population goes through this. This is not rare, it's very common, and it can come and go in life. Happening after age 50 is very common, and it does not mean you need to be in therapy or on long-term medication for the rest of your life. This is something that if we can retrain the brain how to not have those bad habits of anxiety again, oftentimes we can stop the therapy.
Is this more common in men or women?
Actually in women, absolutely, but it can occur in both. So really just looking at those symptoms and reading it as to, could this be what's happening with me or my loved one, is what we should be doing.
You mentioned age too, because
yes.
I mean, obviously, the older I get, the more I start to think about, you know, just the things that can, because we have life experience that often tends to cloud our judgment.
And you know you're not out doing these scary things, but you can't control the loved ones that you have doing that. And so I think it's really natural for that increased anxiety to come into play because you have less control over a lot of things.
Primary care doc's probably the first line
absolutely.
You would go to. And at what point, therapy, psychologist, psychiatrist?
Yes, and even if you call the Tulsa 211, they can get you hooked up if you don't have a primary care provider. Obviously, OSU Medicine, we'd love to help, or even working with a therapist, which you can get through the city connections.
Makes a big difference. 211 is the number if you are feeling that anxiety, that fear, that worry, that dread. Some of that's natural and normal, but if it's just consuming your everyday, you want to definitely get it looked at.
And even if it's just very present, you feel like it's making you a little bit irritable and just, I don't feel as calm as I should be, please come talk.
Yeah, makes a difference. All right, thanks for being here. Look forward to seeing you again. Happy Halloween.
Same.
All right.